Alright, so we're going to be doing anatomy of the respiratory system today. So first off, we're going to be able to want to follow the flow of air. So air is going to pass through your nostrils or your mouth into your nasal cavity. Then we'll go into our pharynx. It's going to have three portions: nasal pharynx, oral pharynx, and laryngeal pharynx. Alright, then we come down and the air will go into our larynx, into the trachea, and then it will go into the main bronchus or primary bronchus. And we go secondary bronchi, tertiary bronchi, and we start getting into our smaller bronchioles. So looking at this anatomy here, let's just cover some stuff. So here's the oral cavity. This is your hard palate and the soft palate. This would be the superior, middle, and inferior nasal concha, and there will be a meatus underneath one of these concha. The function of these are going to be to increase surface area inside your nasal cavity so you can increase heating and humidification of the air before it comes into your lungs. Think of it this way: when it's really cold outside, you like to breathe through your nose so you can warm and humidify the air without damaging your tissue in your lungs. Next thing I want you to see here is notice this membrane here. So we have our serous membrane. This would be our parietal layer. So this is going to enclose the chest cavity for that lung. And then this will have its visceral layer on the surface of the lung itself. So with our breathing, we're going to have two zones. We're going to have conducting zones, we're going to have respiratory zones. Conducting zones are going to clean, humidify, and warm the air. They're going to carry the air into the lungs. So everything we can see here is all a conducting zone. All this stuff is going to be conducting zone. It's going to be getting air into the lungs. Respiratory zone is going to be actually where you can have gas exchange happen. It's going to happen in the microscopic areas, and it starts where we have our respiratory bronchioles. So next we're going to have our respiratory system broken into two parts. There's an upper and a lower respiratory system. Your upper respiratory system consists of your nose, your larynx, and your pharynx. So if you get an upper respiratory tract infection, that means that like you have a sinus infection, or you got a sore throat, or you got something like that going on. Alright, so look in here, just some quick stuff. Here's our nose. Here's the nostril. Alright, the philentrum. Okay, the ala of the nostril. Ala means wing. That's about it. So now we're looking at a cadaver cross section here. So here's my nasal cavity proper. We got our superior, middle, and inferior concha, and there is a superior, middle, and inferior meatus to go with each one. This is going to be my cribriform plate with my olfactory nerves passing through there. Could you see how these nerves are going to be little chemoreceptors to sense chemical changes going on in the air, and they will perceive that as smell. So could you see how if you breathe something in and it comes in contact with these, you could burn them and damage them and cause damage to your smell? Working our way down, here's your hard palate. As the bone dwindles off, it turns into the soft palate, and then it turns into the uvula. Here's the nose. This portion of the nose, you see this line right here that I'm showing you? This is called the vestibule. And these little hairs in here are called vertebrae. So the vertebrae are little nose hairs. Working our way back here, we start with, this is the posterior nasal aperture here. And we get into the pharynx. For you all to know, the pharynx is a common passageway for food and water and air. So all three of them pass through. Once we hit the epiglottis, it is going to divert stuff. Some air goes into the trachea, food and stuff goes into the esophagus. So if you're just breathing, epiglottis is up. Air can pass in easily. It'll go to the path of least resistance, into the trachea. If you eat food, what's going to happen is you're going to, I don't know why that popped up, I'm sorry. But if you're eating food, the epiglottis is going to come down and it's going to block the trachea so the food goes into the esophagus. So here's our pharyngotympanic tube, or auditory tube, or internal auditory meatus, or eustachian tube. Once again, pharyngotympanic tube, auditory tube, or eustachian tube. There's a whole bunch of different names this thing goes by. So this would be our nasal pharynx, and then once we get down here, we get into the oral pharynx, and will be laryngopharynx will be on the next screen. Okay, so here's a cartoon rendition. So we have our vestibule with the vertebrae, which are those little nose hairs. You have your nostril, which is going to be the opening. Okay, you're going to have your superior, middle, and inferior concha with the superior, middle, and inferior nasal meatuses. Here's that cribriform plate, the posterior nasal aperture. Hard palate leads back into the soft palate, and then that turns into the uvula. Now in this view, you get a nice view of your lingual tonsil and your palatine tonsil. Here's your lingual tonsil, here's your palatine tonsil, and here's your pharyngeal tonsils. So those are our tonsils that everybody speaks of. Here's that auditory tube. So here's going to be the pharynx then. We go our nasal pharynx. It goes until the bottom of the uvula. We're in the oral pharynx. Alright, and the oral pharynx is going to end somewhere around this epiglottis. Then we're in the laryngeal pharynx. So here's that epiglottis. So when I breathe in, air comes through my mouth or through my nose. It's going to travel down here, and the path of least resistance is to go down the trachea. If I swallow food, this epiglottis lops down and it blocks off my trachea, so food goes into my esophagus. And then looking here, like we said, here's my epiglottis. Here's the thyroid cartilage. Here's my cricoid cartilage. Okay, and this would be my vocal folds. You'll have a true vocal fold and a false vocal fold. Another name for it is just the vocal fold and the vestibular fold. So here are those cartilages we were talking about in your larynx. So if you have a large Adam's apple, it's going to be caused by your laryngeal prominence. So that's going to be where this guy is. This top right here is your epiglottis. Here it is again here. And here's our cartilages. This is our thyroid cartilage. This is the cricoid cartilage. The ligament that connects the two are called the cricothyroid ligament. The ligament that connects the thyroid cartilage to the hyoid bone is called the thyrohyoid membrane, or ligament, but it's really referred to as a membrane. This guy right here is called a cuneiform. This is the corniculate cartilage and the arytenoid cartilage. Then here's our vocal fold. So we have the vestibular or false vocal fold and the true or just normal vocal fold. See how the cricoid cartilage comes back around here, and here's your thyroid cartilage. Notice your tracheal rings. Your tracheal rings are C-shaped. Do I have a picture of how they're C-shaped? Your tracheal rings are C-shaped. So here's my tracheal ring. It's going to be C-shaped. The reason why it's C-shaped is it's going to have an opening back here because the esophagus sits right behind it, and your esophagus is normally sitting flat. So if I was to swallow food, what's going to happen is my esophagus will expand and it can push into my trachea, and as the food moves back down, everything's cool. So it's just saving space within your body. So here's my base of my tongue. If you're looking at somebody from they're on their back with their head looking at you on a table, and you're looking straight down their throat. So here's the base of the tongue. All right. There's the esophagus. Here's your vocal folds. So if you were gonna stick a tube down somebody's throat to pump them with air, you want to make sure you're not going in the esophagus. You want to go in the trachea. Pick the right hole. You don't want to blow up their belly with air. Here's the epiglottis, so it can lop down and it can block off the trachea, so food could go there, or right now it's relaxed. Here is your true vocal folds. Okay, these little white paper looking things, and here's the false or vestibular vocal folds. The way your vocal folds work, or your vocal cords work, is if you ever knew somebody that took a piece of grass and they'd hold it like between their thumbs or fingers when they were little, and they could blow on it and it would vibrate and make noise, that's the same way your true vocal fold works. So the tighter you pull that piece of grass, the higher pitch the noise. The looser you let that piece of grass go, the lower the noise. Or people, the longer their their true vocal cords, the deeper their voice, the shorter or more tense those vocal folds, the higher pitched their voice. Okay, we're working our way into the lower respiratory system. So you're going to have your trachea, your bronchi, and then with our bronchi we're going to have we'll have our main bronchi, aka primary, secondary bronchi, aka lobar, tertiary bronchi, aka segmental. Then we turn into our bronchioles, so bronchiole, little bronchi, and then terminal bronchiole. Reason why this is terminal, this is the end of the respiratory zone, and we are getting end of the conducting zone, and we're getting into the respiratory zone. So now we call these the respiratory bronchioles, and they'll give off our alveolar ducts, sacs, and alveoli. These are going to be where all the gas exchange happens. And then we'll talk about the pleura of the lungs, the visceral and the parietal pleura. So we already looked at this picture. Here's our C-shaped cartilage, and we have the opening in the back of it, so the esophagus can expand and push into the trachea as you are swallowing food. You'll also notice here that there are mucus glands, because they are going to make mucus to push out into the membrane here. So these cells, first off, this is going to be made up of hyaline cartilage, so it'll be strong and sturdy and it'll give a nice structure. But all the cells around your mucous membrane in here, they have these things coming off of them called cilia. These are cilia. They do this finger sweeping type of action. So if you breathe in stuff or you breathe in junk, they will be coated in mucus, and that junk will get stuck in the mucus, and it will be swept along back up the trachea into your pharynx, so you could swallow it and it could go into your gut and it could get killed. The way I think of this stuff working is, if you've ever seen one of those fly traps that are hanging down in an old barn or like at somebody's house, and they're just the sticky tape and the flies go and get stuck to it. That's how this mucus in the mucous membrane works, is you breathe in debris and junk and it gets stuck in there, and then it gets swept away and your stomach can kill it off. Here's our hyaline cartilage. Here's our mucus glands, and then here's our columnar cells with that cilia. Okay, so here's the flow of our air. We go trachea, main bronchus, secondary bronchus, then we go into our tertiary bronchi. Each time there's a split, we go to the next layer of bronchi. Now I want you to check this out here. So here's my right lung, here's my left lung. My right lung is going to have 3 lobes. My left lung is only going to have 2 lobes. The reason why the left lung is only going to have 2 lobes is that my left ventricle protrudes into my left side of my chest, and it takes up part of that chest cavity, so there's not enough room to have a 3rd lobe on that left lung. This thing that says right main bronchus is incorrect. That is your left side, it's not your right side. So this is the left main bronchus. This is the right main bronchus. So I have my main bronchus. That means I have 1 bronchus for each lung. My secondary bronchus, I'll get 1 secondary bronchus for each lobe of the lung. So for my right lung, I have my superior lobe, my middle lobe, and my inferior lobe. So I get a superior secondary bronchus, or I get a middle secondary bronchus, and I get a inferior secondary bronchus. Another name for these bronchi, as we see here, are the lobar bronchi. Hence, superior lobe, middle lobe, inferior lobe. Inside each of these lobes, okay, these lobes are going to break into segments. So my right lobe has 3 segments, my middle lobe has 2 segments, and my inferior lobe actually comes up through the whole back of the lung like this. It's going to have 5 segments. That's going to be the biggest lobe of the lung. With my left lung, we'll only have a superior and an inferior lobe, so you'll only have 2 secondary bronchi for this lung, so it'll split off here and here. We only get our 2 secondary bronchi. And my superior lobe will have 4 segments, and my inferior lobe will have 5 segments. This thing right here, we call it the carina. It's going to be where my trachea splits into my 2 main bronchi. If anything touches this, you get a violent coughing reaction. If you've ever breathed something in and you just start coughing so hard you're like spitting stuff out of your mouth almost, that is your carina being agitated. Okay, so here's the flow of air. We go primary bronchus, secondary bronchus, tertiary bronchus, terminal bronchial. Now we're getting into the respiratory stuff. Respiratory bronchial, alveolar duct, alveolar sac. So we're looking at microscopic feature here. Okay, as we go from the terminal bronchial into the respiratory bronchial, we start to see these little bean-looking things pop up, or grape-looking things pop up. These are called alveoli. These are going to be actually where gas exchange is occurring. As we go into the alveolar ducts, we have lots more alveoli coming up, and then we get into our alveolar sacs, which are big groupings of alveoli. Okay, so we have an alveolar duct passing through here, and the sac would be a whole bunch of the alveoli there. So gas will come into these, and this is going to be where gas exchange will happen with the blood. So here's what an alveolus looks like blown up. We're going to have some different types of alveolar cells. We'll have type 1 alveolar cells, which will be simple squamous epithelial cells, one cell layer thick, and it will be so thin that it will easily let gas pass through. So we're going to look here. This is a blood vessel, this is a capillary, this is my alveolar wall. So here's my thin alveolar, type 1 alveolar cell, here's my capillary, so we can let gas pass in and out. Okay, oxygen goes into the blood, carbon dioxide comes out of the blood. This right here is my respiratory membrane. It's made up of a couple things. I think, let me highlight this for you. It's going to be made up of the alveolar epithelium, the basement membrane, which acts like a glue. So here's my alveolar membrane. Here's my basement membrane to glue my capillary bed, or my capillary endothelium, to my alveolar epithelium. Okay, also within our alveoli, we will find macrophage, and we will find these guys right here, type 2 alveolar cells. These are the last cells in your body to mature before you are born. When babies are born and they have a hard time breathing and they're in respiratory distress, the reason when they're saying their lungs aren't completely developed is they have not started making these type 2 alveolar cells yet. The function of these type 2 alveolar cells is they make something called surfactant, and surfactant will decrease the surface tension inside this alveolus. Okay, so let's think of this alveolus as a balloon. If I have a little balloon and I go try to blow it up, sometimes it's really hard to blow up, right? So if I take that balloon, I stretch it out a couple times, it warms up, and now I can blow it up real easily. Yes, that is basically how I would picture surfactant working. Now, the reason why I want these alveoli to blow up is, first off, we want nice fresh air to get into them. But second off, as you blow up that balloon, it gets bigger and bigger and bigger. What happens to the thickness of the membrane, or the thickness of the balloon? It's going to thin out, so it's going to make a thinner wall for the air to pass, or oxygens and gas and carbon dioxide to pass back and forth from the blood to the lungs, and vice versa. Okay, some big anatomy features. Here's my superior lobe, my middle lobe, and my inferior lobes of my right lung. We call this the horizontal fissure, and this is the oblique fissure. When we speak of the oblique fissure, there's also an oblique fissure on the left lung, and you're going to want to identify this is the left oblique fissure and this is the right oblique fissure, since there is one on the left side and the right side. Next, we can see our nice pleural serous membrane. That's the outline of pink. So the parietal layer encloses the chest cavity. The serous, the visceral layer, is on the surface of the lung itself. Here we're looking at a lung. Here's the main entrance point for it. I've talked about this in previous lectures. Main entrance point for organs is referred to as the hilar region. So this is the hilum of the lung. So we'll have those pulmonary veins, which have oxygenated blood coming out of the lungs, and we'll have a pulmonary artery, which has deoxygenated blood heading to the lungs to dump off carbon dioxide and get oxygen. And then here's our pulmonary bronchus. Alright, so here's the way the pleura works. Here's my parietal pleura. this outer cavity, and then we have my visceral pleura. If you notice, the lungs are in their two separate pleural cavities. Why? If you stab somebody in the chest and their right lung collapses, they still have their left lung as a backup mechanism. So you have two lungs because you want a backup mechanism. Your body's going to go in shock when it just goes from one lung to two lungs, but over time it can compensate and it can deal with just having one lung. Now, the way your lungs are going to work is you have your parietal pleura and your visceral pleura. In between them, there's serous fluid, or your pleural cavity. That fluid is going to hold them together. Almost picture taking a glass of water and it sweats, and you put it on the counter and it's sitting there for a while because it starts sweating and getting a nice watering at the bottom of the glass of water. You go pick up your glass of water and it resists you a little bit. That little resistance is going to be how the lung attaches to the wall of the chest. So now if I take a breath and I expand my chest cavity, my lung is going to be stuck to the wall of the chest cavity, so it's going to expand with my chest cavity. And we'll talk about a lot more about that in the coming lectures. So here's my trachea, my main bronchus, my secondary bronchus. Then we go into our segmentals. So we said our right superior lobe had 3 segments, middle lobe had 2 segments, and the inferior lobe had 5 segments. Superior lobe has 4, inferior lobe has 5. I just want you to know the number of the segments. You don't need to know the names of all the segments and their different pieces. And that's it for today.